back in June 2025. And Nancy, the floor is yours.
Good morning, and thank you for taking the time to join us today. Um, for those I've not had, I just saw me going out of the video. I'm not quite sure why that's happening. Okay. For those I've not had the chance to meet, I've had the privilege of serving as CEO of Mary Center for the past 10 months. Just to quickly share a little bit about myself, I spent over a decade in hospital administration, working alongside community health centers, and that's where I fell in love with this movement and then decided to dedicate my career to it. And I'm so grateful to now be part of Mary Center. All right, so this brings me to what we're seeing in the community today. I want to go to the next slide. When we step back um, and look at our community, a few things are clear. Chronic conditions and behavioral health needs remain high. Economic stability is mixed, and access to care is becoming more difficult. Those are the facts. But what we're seeing right now goes beyond the data. In October 2025, DC made changes to the Alliance program, which provides coverage for residents who are not eligible for Medicaid. As part of those changes, access to adult dental and behavioral health services became more limited. And that truly matters. When patients lose access to dental care, it becomes harder to manage chronic diseases like diabetes because oral health directly impacts overall health. And when nearly 1 in 4 of our participants is experiencing anxiety or depression, any reduction in behavioral health access creates real risk that people won't receive the care they need. And that is why our model matters so much. Our social change model looks beyond a single visit, addressing the social and structural factors that determine whether someone can actually receive care, stay connected, and ensure their family thrives. But to understand why this matters right now, it's important to look at what is changing around us. So in the next slide, you'll see first on the policy side, grant funding is no longer guaranteed, and it's becoming more and more uncertain, creating challenges for long-term planning. Second, financially, costs are rising. We're seeing workforce shortages across healthcare, and it's becoming more expensive to deliver the care every day. And then third, at the community level, families are under real economic pressure. For many, it's getting harder to manage basic needs, which makes staying connected to care more difficult. Looking ahead, we expect more people to lose coverage, and by 2027, policy changes could mean significantly more adults without health insurance. We're already seeing that in other states. So in Georgia, where new work requirements have already been introduced, Medicaid enrollment has been much lower than expected. But we are responding. So I'd like to share a few things of how we're working through this challenge. First, we're seeing real growth in our senior population, especially in Montgomery County, and we're stepping up to meet that need and also diversifying our payer mix. We're also seeing participants who are afraid to come in for care for a range of reasons, and we're exploring new ways to stay connected, such as digital tools, so they don't fall out of care. We've entered into value-based contracts, and with our top-notch quality performance, we expect to continue to generate shared savings and be financially rewarded for our positive outcomes. And we're bringing partners together like local hospitals to expand access and make sure people can get the coordinated care that they need. And I would be remiss if I didn't close by recognizing the incredible work of our team. You're about to see a slide with all the recognitions from the last about 18 to 24 months. Just this week, we received the Dr. Cesar Caceres Award for Innovation in Healthcare Technology, recognizing our commitment to using digital tools to stay connected to our most vulnerable patients. And then we were awarded the National Association of Community Health Braun Advocacy Center of Excellence designation for our advocacy efforts. I'll end by saying I'm incredibly proud of this team, and you'll hear more about this work throughout today's conversation.
Thank you, Nancy. Now I'd like to introduce Mary Center's Director of Home Visiting, Fernanda Ruiz. Fernanda has dedicated over 20 years to Mary Center, holding various roles within our home visiting program, and she'll be sharing more about it with us this morning. Fernanda, please take it away.
Thank you, Sarah. Good morning, everyone. Um, I would like to start talking a little bit or going a little bit deeper into our social change model that Nancy just talked a little bit about it. As she said, we know that if we want our communities to thrive, treating health problems is not going to be enough. We also need to address all aspects of well being if we really want to move the needle and also if we want to impact quality of life. So let's take families of young children, for example. Families who live in poverty, are immigrants, and have limited social supports are at a high risk of poor maternal and child health outcomes. Parenting is also impacted by social drivers of health. The top family issues resulting in maltreatment include substance abuse, unstable housing, and domestic violence. So, both social drivers of health and adverse childhood experiences play an important role in the health and the well being of individuals, families, and communities. So for this reason, Mary Center, or here at Mary Center, we use a strategy of home visiting to foster resiliency among vulnerable individuals and families because we believe that risk is not destiny. Home visiting is a prevention and early intervention supported strategy for expecting parents and families of young children. Next slide. Thank you. So, within our home visiting program, we have a mix of both evidence based and mission driven models. And we currently offer four home visiting models, which are our Healthy Families America, the longest that we have had since 1996, Father Child Attachment, Nurse Family Partnership, and Healthy Start. And while all four models share the strategy of home visiting, each one of them is designed to serve a specific population and address a specific area. Within the program, we serve the district and Maryland. We also have a multidisciplinary team that includes home visitors, nurses, supervisors, and program managers. And we currently receive funding from private, local, and federal sources. And we're able to generate some revenue through billing for services to Medicaid in Maryland. So, it is important to note that home visiting services are entirely voluntarily. Families joined our program because they want to do better by their families. So, when a family chooses to join one of our home visiting programs, they are assigned a dedicated home visitor to work with them. And home visits are going to be flexible. They can be during the day or time. We try to adapt as much as possible to the family's availability. And each home visit is going to be tailored to the family's interests and the developmental stage of the child. So during our home visits, we provide information on child development according to the stage where the child is, and we use an evidence based curriculum. We also bring activities for the parents and children to use so that it can also strengthen the child development and prepares the child to be ready for school. Also, our home visitors link families with resources and services available to them in the community based on their interest, but also on their needs. And we also provide case management and family goal planning. All right. So I would like to close by sharing a little bit of our impact in 2025. Last year, we served 422 families and we completed 3,317 home visits. We also had the honor to graduate 91 families from services. Every year, we celebrate our graduation in September, where we have the opportunity to celebrate along with families all their achievements. Um, and from the families enrolled in home visiting last year, 91% of the babies that were born were full term and had a healthy birth weight. 88% of children 0 to 2 years old were up to date with immunizations, and 99% of at risk families remain free from child abuse and neglect. Thank you so much.
Thank you, Fernanda, and congrats to your team for all the amazing work you're doing and all those incredible outcomes that we're seeing. So, the next part of the session, we'll transition into a roundtable conversation where Nancy and Fernanda will share their insights and perspectives. And I'm going to kick things off with a question for Nancy. And I want to ask, what drew you to Mary Center and what continues to inspire your commitment to this work?
Absolutely. You're going to hear the social change model a lot during this conversation, but certainly it is one of the beacons of this organization, and I think it's a showcase of what can happen at a national stage. I had worked in Colorado and then moved to Maine, followed my leader, and then when he retired, moved to Texas. So I've been in three markets before DC, and I had the opportunity to work with a lot of partners along the way. And I've never seen anything as well done as what has been created here at Mary Center. And I can give you an example. One of the pillars is education. And that's very near and dear to my heart. Neither of my parents graduated from high school. And my mother worked really hard to make sure that I was educated, and I am the product of that education. And so when you take a look at our education pillar, which provides adult education classes through our partner BRIA, as well as early childhood education to ensure that families thrive, that is really meaningful. And I will say when I interviewed, I had the opportunity to visit many of the classrooms. And at one point, some of the students interviewed me. And one of the students asked me, "Will you fight for us?" And it was at that moment that I really understood the responsibility of the role. And I am so honored to be able to fight for the people of this organization and the communities that we serve.
And Fernanda, I want to ask you a similar question. What originally brought you to Mary Center and what has kept you here for 20 years? Particularly in home visiting, by the way.
Thank you, Sarah. So, 20 years ago, applying for a job was very different. I remember I saw, well, one, I was fresh out of college and I had just moved to DC. I was a new immigrant and I saw a job posting for a home visitor position on Craigslist of all places. And I thought this position is perfect for me. So I showed up the next day at Mary Center with my resume in a folder. And by luck, the head of human resources was available and was able to meet with me. Kind of like everything just flowed from there, which was great. Um, and it was a perfect job for me because I feel that as a new immigrant and in a new city, Mary Center provided me with a community. It provided me with a community, it embraced me, but also it provided me purpose in 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 doing the work that I was doing. And I it was awesome to do the work as a home visitor. I was going into families' homes, getting to talk to them and connecting them to to resources in our community. But what I really loved and what really like stayed with me is that we all want the same things. We want to belong, we want our basic needs met, and we want to do better for ourselves and for our families. The families that I was meeting, they were going through different challenges at different times, welcoming their babies, but we all wanted the same. And that really, made a big impact on me. And so when I look at my journey at Mary Center for the last 20 years, I feel very grateful because thanks to Mary Center is that I was able to stay here in DC as an immigrant myself. And also I've been able to grow along Mary Center and our home visiting program. Uh, we went from one program to four different home visiting models. We expanded into Maryland, and we have supported like thousands of families along the way. So, seeing Mary Center grow to meet the needs of the community and use innovation while remaining grounded in our mission, that's what has kept me engaged during this time.
Thank you for sharing that insight. Nancy, I want to ask you, what reflections do you have on your first 9, closer to 10 months as CEO?
Yeah. I knew that Mary Center was special when I took the role. I didn't realize what it meant to DC. It is truly a longstanding beacon of hope for so many families. And I would also say that because of that, many people have come or reached out to me to make sure that we have the support that we need and that we are successful. And so, from all the FQHC leaders that met me and made sure that I had the resources that I need, and we have come together to solve some of the biggest challenges in the district, to the community who's reached out to introduce themselves to make sure that I understand and can navigate the system, and then to the Mary Center family who have embraced this challenge that we are facing and has worked so hard with so much heart. I would just say the community is a very special place.
Yes, and I just want to echo your sentiments and say thank you to all of our supporters who have stood with us and have also reached out to Nancy about, wanting to be there for Mary Center and asking how they can help. So we appreciate that so much. And Fernanda, looking back over the past 20 years, how have you seen Mary Center and the community grow and evolve?
Mhm. Thank you. So it has been amazing to see Mary Center grow and evolve during these past 20 years, but also at the same time, our community and the environment have changed tremendously from where we were. When I started at Mayor Center 20 years ago, we were 70 staff members. We all knew each other. And even the other day, I was telling the anecdote about how Maria Gomez used to give us rides back home in the Mary Center van after the Mary Center holiday party, right? And today we're 800 staff members and we have 5 clinics between Maryland and DC. So it's a huge change, right, that we've been able to see. And I feel like yet the most amazing component is being able to see how Mary Center has evolved to meet the needs of the community and how we have developed programs and have innovative ideas. So, for example, in our home visiting department, we have the father child attachment program, which is the only fatherhood program or the only home visiting program available for fathers here in the district or in the entire DMV area. Um, Before COVID, we were already providing telehealth services with great success, right? So when COVID happened, it was very easy for us to pivot and be able to change into telehealth services across the agency and, meet the needs of the community at that time. We now have like a pharmacy, we have dental services, we have a sonography clinic. So while we've been able to grow our line of services, we have remained participant centered, which I think is also very important to stay grounded in our mission. And obviously, not every idea has flourished. But I think it's really amazing that we have innovated and that we have dared to do something different.
I want to also ask both of you this question about when a family first connects to Mary Center, what challenges are they often facing, and what does life look for them about a year or two after that?
I think we provide full circle support. So let's just use an example. Mom needs support. She goes to her medical visit. Her provider lets her know that there are resources within BRIA where she can receive English languages. And if she chooses to, since she seems to have an interest in healthcare, she can go through the BRIA MA program. And after the MA program, which is our medical assistant program, which Mary Center hires a third of those medical assistants that go through that program. She then comes to work for Mary Center, and she provides the same support and allows and teaches others that this mechanism is here and that they should take advantage of these services as well. And so it just continues to evolve as uh, folks go through our program, other participants go through our program, and we help more and more families thrive.
So let me speak now from like the home visiting side, right? Which is also very similar, like many families who are welcoming new babies. So we're oftentimes meeting families at a very vulnerable time in their lives because they're welcoming a baby. Many times they're first-time parents, so they're also shifting their own identities as they become parents. And that in itself can be a lot for a family. So now, if you add other stressors, as we were talking earlier, like if you add housing instability, financial hardship, isolation, and then structural challenges like racism and inequity, like it can be very daunting for our families. So let me share with you the story of a family who recently graduated from our Nurse Family Partnership Program. And for to respect her confidentiality, I'm going to call her Marlene. And so Marlene came to Mary Center first because she was having trouble getting pregnant. And while doing like lab tests and different things, she received the results that there was an abdominal biopsy that revealed that she had lymphoma, right? So she started receiving chemotherapy and cancer treatment. And 4 months after she started chemotherapy, she realized that she was pregnant during one of her visits at her doctor. Because of the chemotherapy, like side effects, like she didn't, and because of her difficulty before getting pregnant, like she completely missed the signs of pregnancy because she thought that it was about the chemotherapy. So it was very scary for her at that moment, being a first-time mom, going through chemotherapy, like, learning that she was going to be pregnant. So we were able to connect her to a nurse in our nurse family partnership program. Her name is Maggie, and Maggie was able to support her along that process. Marlene doesn't speak English or is learning to speak English, is her second language. And I mean, just going into sometimes a doctor's visit, and I can relate because English is my second language. At times, it's very hard to understand everything that you're receiving, all the information, and having a nurse next to you that can take the time to later explain to you piece by piece can give you a huge peace of mind. So Maggie provided that support along the pregnancy. They paused the chemotherapy until after the baby was born. And Marlene started to feel more comfortable, more confident about her pregnancy. And she delivered a healthy boy. She was able to deliver full term with a healthy birth weight. And later on, she started to continue with her chemotherapy. And once she became a parent, also Maggie supported her. For example, she was struggling to produce enough milk. So, like providing information about how through natural ways she could produce more milk. So, to make sure that her baby had a full tummy. Also, the baby started having an allergic reaction to diapers. Maggie was able to support her along the way. She later connected her also to Bria because Marlene wants to be a medical assistant and at one point, hopefully, be able to work at Mayor Center and give back some of what she has received. And so um, recently we graduated her from the program, and it was great to see her where she is right now, in which she's cancer free. She's connected to Bria. She's pursuing her dream to become a medical assistant. But I think the most rewarding piece is just seeing her with her baby and the attachment and the bonding and how having someone support her allow her to slow down and just be present with her baby at a time that it was very stressful.
Thank you, Fernanda. I'm so glad to hear that Marlene and her baby are doing well. That's a remarkable story, and she really overcame a lot. And I know you've already talked about the challenges that our participants are currently facing, but Fernanda, since you've been here for over 20 years, can you tell us a little bit about how the challenges today compare to the challenges our participants were facing 20 years ago?
Of course. So I think in one way, I feel grateful that we have more resources at Mary Center and things that we can offer at the same time. And even like, I wouldn't go even that far back to 20 years, just 1 year ago, right? The families are afraid of coming to receive services. Our home visitors sometimes report how they're seeing ICE on the streets during raids and how this has had a huge impact. And so I feel that many of our families are on top of everything that they already had. Now they have this chronic stress because you don't know what is going to happen to your family. And we have families that come sometimes and ask us if we can help them to come up with a plan, a safety plan, an emergency plan. Or I have had families at times ask if, we would be able to take their kids if something were to happen to them. And that's just heartbreaking, right? What we're seeing in our communities. Um, so I think like our families are facing, it has just really highlights where we are in this time in our communities, in our country. And we just hope that by providing these services, by going into the homes, by providing telehealth services, we can continue to provide access to families, that we continue to provide them with support and information so that they continue to thrive.
And I know we've talked a lot about the social change model today, but I do want to hear from you more about why you think it's effective. For those of you who don't know, in 2019, the Urban Institute actually researched and did a study on our social change model, and found that it was very effective. And I'd just love to hear, what your thoughts are, especially Nancy, as you're new to Mary Center, and I'm not sure how familiar, at other community health centers, what are they doing to help ensure that all of the participants are supported in this way?
Yeah, I'll start and then pass it over to Fernanda. So I think many community health centers across the country, at least those that I have either uh, partnered with or worked within, start through medical services and then later on layer in social services. And I think the big difference between that and Mary Center is that at the foundation of Mary Center back in the late 1980s, it was built off of the social change model. It wasn't an afterthought after developing medical services. And so, because it is part of the fabric of our organization, and stands as a pillar equal to medical, we have been able to provide a lot of services for patients over the years. And we talk about, you hear a lot about emergency rooms, and if we don't provide primary care, folks will end up in emergency rooms. Really, social services and the needs of our community is just as important not to end up in the emergency room. If you do not have food or housing or other challenges within your home, that makes it very hard to stay healthy. And so the full component is what makes our patients thrive and move forward within their communities.
Thank you, Nancy. I couldn't agree more, right? I feel that the way that we were founded was because we wanted to make sure that families, and at that time, women who were pregnant were able to get access to care. And Maria knew that it was not enough to provide the medical care, right? If you don't have food at your table, if you are concerned about whether you're going to have a roof under your head, medical care becomes second, right, to your immediate needs. And so being able to provide those supports allows us to break those barriers for families, right? It allows us to make sure that families are feeling that they're taken care of, that also they're able to better themselves, and then they can spend time thinking about their health, right, and also the health of their children. So I think that is very important. We see the outcomes that we have when we look at our pediatric services in terms of the immunization and different things like the well child visits, right? And that's just not happenstance. It's because families have the access to care For example, most recently, we have had grants that allow us to provide Uber rides to families so that transportation is not a barrier. And that's because we identified a need. That at times families were not coming just because it's like a challenge. If you have three kids getting on the bus and you have a stroller, like it's just a lot. Right. So now having that Uber ride can facilitate things, being able to access services in your own language. And just the way that Mary Center also, like, if, for those of you who have come to Mary Center, I think it's really cool how we are designed that all the services are around you, right? So you come in, you are in the waiting area, and then from there, like, you are directed to different places. But the idea is that services are gonna wrap you so that it's easier for them to navigate. And also the other piece I feel is that, I mean, I'm a social worker, so from that perspective, I think like self-determination is really important. And we understand that. Families and individuals can come to Media Center and it's up to them what services they want to receive. We offer them, but we have families who, for example, are only in our home visiting program and they receive perhaps care somewhere else because it's closer to their home, and that's okay because we want our communities to do better, right? We have families who come and receive medical care here and they receive behavioral health, but maybe they're not interested in home visiting, and that's okay too because they're choosing for themselves what is best. And I think that that's very important that on the medical model, many times we think that we know best, and we take the approach that our participants, our communities, they know best, and they'll access what they need. So I think it's really cool too.
And if a family like Marlene's was standing in front of us this morning, what would you want supporters to understand about what Mary Center has made possible for them?
I think that, and yesterday I was actually reading her testimony because she's been a great supporter of home visiting and Mary Center in general. And when I was reading her testimony, she talked about how Nurse Maggie was a guardian angel for her because she felt that she had someone on her corner that cared about her, that really took the time to be with her and support her along the process, and how that really eased some of her fears as an immigrant. With a language barrier, with her medical condition. And so being able to kind of like lower those anxieties, those fears, really opened her up to be able to access care and being consistent, right? And feeling that she had a full understanding about her healthcare, which I think is also so important, right? To make sure that our participants, when they come in, they fully understand their diagnosis, their treatment, and why is it that we're doing what we're doing, that we are partnering with them in to make sure that they're healthy and thriving. So I think that's what I hear most often, that families feel that they're grateful because they have someone who cares about them, and who doesn't want to be like feel seen and heard, right? That can mean so much and can really allows us to trust, especially in these times that we are in. Is very difficult for our communities at time to trust agencies, right? And there's a lot of fear, and being able to build those relationships, I think that makes a big difference.
And this is also for both of you. When you look ahead to about 5 years from now, how do you hope Mary Center's work will have contributed to this community?
So, as we've alluded during this conversation, Mary Center is very, very innovative. You think about the fact that this was all created in the late 1980s, and yet value-based care didn't really pop up as part of the fabric of the healthcare industry until maybe 2011, 12, and social determinants of health. And so, I think that what I'd like Mary Center to do is to continue that journey of innovation on behalf of the communities we serve. For example, when we started to have the challenges with ICE and other issues where folks were afraid to leave their homes, I was able to call peer organizations in Chicago and LA where that fear has hit pretty hard and ask, what are you doing? In which digital monitoring and remote monitoring tools were shared with me as not a perfect solution, but did help stay connected to patients that were afraid to leave their homes. And so when reaching out to the Medical Society of DC, which had an award to allow us to start this program, which we just received this week, we are able to continue to innovate and evolve as the needs of our community evolve. And I hope that we're seen as an organization that always meets the needs of our community.
Thank you. I definitely I'm curious to see where we go from here and what innovative ideas come to light as we, step up to meet the needs of the community. I'm also very excited to see how we're continue to strengthen our advocacy arm at Mary Center and how, again, because the social drivers of health and we want to do things better, we understand our community. I really appreciate how, with Nancy's leadership, we continue to step up to advocacy and see what policies do we need to change, right? Because if I'm seeing families and I'm seeing that there's a pattern, they're experiencing similar issues, well, maybe we can do so also something at the systems level. Right. So, how are we stepping up? And also, how are we supporting our participants in providing a voice and make them part of that change because it shouldn't be done for them. It should be, all the change should happen with them. And so I'm really excited to see that, to see how our community continues to inform and advise in which ways they want us to go. Um, and I think, many exciting things can happen.
And I want to add to that, Fernanda, we actually have a community engagement council, which is made up of participants. And that committee that allows us to hear feedback from participants. So, they can tell us what's working, what are some of the needs that they think we can address better. So that's really incredible. And I'm really glad that we get to partner with our participants so we're hearing directly from them about their needs. And I just want to say what a powerful discussion and a meaningful reminder about what's possible through this work. Now we'd love to hear from you. We'll begin with questions submitted in advance of the town hall and then turn to those in the Zoom Q&A this morning. So I'm going to start out with one question we had, which the rapidly evolving political landscape is easy to imagine as an obstacle generator, but what are the biggest opportunities for Mary Center? What has been unlocked in unexpected ways?
Yeah, there's where there's challenge, there's lots of opportunity. We learned that during COVID, and so I truly believe that there are a lot of things that we can do through this challenge. One of which is the FQHC leaders across the district have come together to work through the challenge with Alliance benefit being rolled back. And we have some ideas that we are providing the district on how we can save costs. One of which is to make sure that our FQs across the district are seen as the first line of taking care of our participants. And so I would say through that kind of innovation and coming together through partnerships, we're also talking to many of our local hospitals to say, how can we work together if your EDs do become pretty full during this time of challenge? And because we're starting to all work together and try to solve these issues together, I do believe we will overcome them.
And another follow-up question, how is Mary Center adapting to the changing public health environment? And is Mary Center working with organizations like the National Association of Community Health Centers on community health center and public health collaboration?
So we are part of the National Association of Community Health Center community. I participate in a lot of their sessions, and so does our other leaders throughout the organization. There are many strategies that NAC, which is the acronym for that, has laid out for us in order to thrive during this period of time. And we are certainly taking a lot of that counsel and putting that into action.
And how is Mary Center's original model saving money in the long run? And how is it being financially affected with all the cuts in the different payer sources?
Fernanda, do you want to start on that one?
Sure. Thank you, Nancy. Uh, well, I can speak from the grants perspective, that type of funding, and we have definitely been hit hard on this area. Like just before the town hall, I was talking to Sarah last year. We had to close our USCRI program, that was the program that we had for undocumented minors that are on a refugee status, and that was a big loss. I had to close an amazing team of 60 individuals that were doing amazing work. And, it's just hard also because not only like saying goodbye to good staff, but thinking about who's going to be supporting these kids that are by themselves here in the country and are trying to navigate a legal system as a refugee. So that is very hard. And I think that 2025, at least for me at a personal level, it was very hard to see how we were losing funding, how things are shifting, about what you can say in for a grant and what you can't say, and how like needs that you see, like when you look at the data, you can see, for example, in the district where infant mortality, like the maternal infant mortality rates are impacting certain communities more than others, right? Our Black and African American communities, followed by our immigrant communities. And so you need to talk about equity and how you make services available to them. But then, there's other challenges when you look at the federal landscape. So I think like that has been very challenging for us. That said, we I feel like are very strong in terms of the support that we have. Some foundations have reached out and have continued to provide our support. Some of our partners, at the federal level, have continued to support us and provide guidance about how can we navigate these times. Maryland has been very supportive as well. So I feel like it's been challenging. And then on top of that, you try to then think about, okay, long term, how can I diversify my payer mix? So in Maryland, we already have the reimbursement mechanism for home visits. Here in the district, 2 years ago, we were able to pass legislation to provide Medicare reimbursement for nurse-led home visiting services. And right now it's stuck with our deputy mayor because of a technicality, and some challenges with between council and them. So we haven't been able to get it to the finish line, but we might have a different mayor. It might look different. So just continue to look and work with our partners in the district, with council, our legislators. I feel that you just need to diversify and look at different strategies.
And we have some questions that were submitted in the Q&A, and I want to ask one supporter asked, "What is BRIA?" So if one of you can just give a little overview of our partnership with BRIA Public Charter School, I think that would be great.
So BRIA is our strategic partner for education. They are a charter school. They are only in DC at this time. They're not in Maryland, but they have classrooms in all three of our DC locations. And they provide both early childhood education as well as adult education, where they provide English language classes as well as MA, so our medical assistant classes, which is where a lot of our medical assistants receive their education, as well as education certification as well.
And we do have a lot of BRIA students, as Nancy had said earlier, join the medical assistant program and then come to work at Mary Center. So, we're grateful for that collaboration. Let me grab another question. Nancy, could you say more about how you see Mary Center serving the growing number of older participants within the social change model?
So we just completed a market assessment to understand how our community might be changing over time and over the next few years. Just like the national projections, we do see that older adult growth is very much increasing in Montgomery County. It is also increasing in DC as well. And so we have an opportunity now. This has not always been the participants that we have served. And so we will start to build that programming within our social change model so that we can also help our adults thrive, our older adults thrive.
Oh, we have a comment that says, we see that Mary Center does not offer vision services. What challenges do you face in offering vision services?
So through that market assessment, which we just received last week, ophthalmology was named as one of the top needs within our community. It is very hard to get ophthalmology services in general within DC. And so that is another area that we will be looking to partner with to bring ophthalmology within our clinics.
And what has been done to improve the customer service experience? I know we have been getting great insight from the Community Engagement Council, but Nancy, I'd love to hear more about your perspective on that.
Yes. Um, There is a lot of work that our front desk team members have to do each day, whether they are screening patients for financial eligibility, checking them in, and all the steps that go along with that from a compliance standpoint. Um, from a macro level, we are hoping to start to automate some of those processes. And so we are working with internally within IT to start to build the workflows that help take the manual processes out of it as much as we can so that our team members are able to take the time to greet participants as they come in and have those meaningful conversations. And so that work has embarked, and we will continue to provide updates as we move forward.
I think we have time for about two more questions. How do you think about prioritization? There's so many needs in the community with many different populations with very different financial characteristics for Mary Center. How do you pick what to do?
I think just like Mary Center was built off the needs of the community, it's outside in thinking. So we take a look through community needs assessments, market assessments to understand how demographics are shifting, what services are not in the district or in Maryland that is very much needed, and what are the drivers of social needs that we need to consider to make sure that our participants thrive. And so we use a lot of data, both quantitative and qualitative, to make those decisions like ophthalmology, where we can see a big need that we need to fill the gap.
And what does Mary Center need from the supporters on this call and how can they help?
Um, I think Mary Center has come up with a lot of innovative solutions to meet the moment of today within our operations so that we continue to thrive. But at the same time, funding is very uncertain at this time. We do not know any given day when we wake up if there will be a federal law that comes down that says that something that we were doing today can't be done tomorrow. And so I think, providing us with that support should key grants have to no longer be here is probably the best thing that our supporters can do. And I'll pass it on to Fernanda for her thoughts.
Thank you, Nancy. I couldn't agree more. And I think that we have received like great support. Even for example, when I look back, our newest model is a nurse family partnership program, and it's because we saw a need in the district for first-time moms, and it has very well received. And that was possible because we had seed funding from foundations, and because they have continued to provide us support, and well, we continue to fight for the Medicaid reimbursement. So I feel that. Foundations have been able to be like a great support. And I have really appreciated the few of them who have reached out and asked, how are things going? We know about ICE rates, we know about the cut in services of grants. What are your needs right now? So I feel that has been definitely great. And also, I really appreciate when they have partnered with us, not only for funding, but also for advocacy and being able to pressure. At times, a larger foundation may have, like some weight on some of our politicians. And I think that's great when we're able to, incentivize the local government to also partner with us in addressing the needs of our community.
And I want to add that we're very fortunate to have individual supporters and corporate partners as well who provide a lot of unrestricted support that allows Mary Center to address needs as they arise. Like, for example, uninsured participants, when they can't afford to pay, we don't turn them away. And so we need help, ensuring that we can provide this uncompensated care. So I want to say thank you. We're going to wrap up the Q&A portion of the event. And if we didn't get to your question, we will follow up with you individually and respond to your question. And before we conclude for today, I'd like to leave you with a few meaningful ways that you can stay engaged and support our work. So one really easy way to support Mary Center is by supporting one of our in-kind drives, like our diaper drive, by purchasing items on our Amazon wish list. These items are distributed to participants who come for appointments at our clinics and directly from our home visiting staff who are going into the homes of participants. You can scan this QR code if you'd like to access the Amazon wish list. And lastly, we do have a few amazing fall events coming up that really offer a way for you to feel connected and give back to Mary Center. On Saturday, September 19th, the Latino Executive Network will be hosting its third polo match benefiting Mary Center. And this is a really fun and engaging afternoon of polo, networking, and community impact. And tickets will be available soon, so stay tuned for more information on our website. And then on October 4th, which is a Sunday, lace up your sneakers and join us for the 2026 Fall Classic 5K and Half Marathon, which takes place in Georgetown. Registration is now open, and you can scan the QR code on this slide to register. And finally, on Monday, October 19th, we're pleased to announce that our corporate partner, Omni Business Solutions, will host its annual golf tournament benefiting Mary Center at Lakewood Country Club. We'll provide more information soon with details on foursomes and sponsorship opportunities. Well, I want to thank you again for making Mary Center a part of your Friday morning. We are so grateful for all you do to uplift our communities, and we just want to say we appreciate you standing with us, especially during some challenging times. Thank you so much, and we hope you have a wonderful weekend.
Thank you.